NCLEX-RN Practice Questions. Question 1. A client diagnosed with pneumonia states difficulty in producing a productive cough. The nurse should instruct the client to complete which of the following to maintain airway clearance? A. Decrease fluid intake. B. Pursed lip breathing technique. C. Splint the chest when coughing. D. Deliver oxygen via nasal cannula. Correct answer, C. Splint the chest when coughing. Rationale. Clients diagnosed with pneumonia often experience pain when coughing. Coughing is less painful and more likely to be effective when the client splints the chest during coughing. NCLEX-RN Practice Questions. Question 2. A client requiring prolonged mechanical ventilation has the following arterial blood gas, AVG, results, pH, 7.49, PaO2, 85 mm Hg, PaCO2, 30 mm Hg, HCO3, 25 MEq/L. The nurse interprets these results as A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. Correct answer, D. Respiratory alkalosis. Rationale. The high pH indicates that the client is experiencing an alkalosis, and the low PaCO2 indicates a respiratory cause. NCLEX-RN Practice Questions. Question 3. A client is diagnosed with angina pectoris. The nurse has instructed the client on the proper use of a nitroglycerin sublingual. The nurse also informs the client that which of the following adverse effects may be caused by this medication? A. Flushing, dizziness, headache, and pedal edema. B. Headache, hypotension, dizziness, and flushing. C. Nausea, vomiting, depression, fatigue, and impotence. D. Sedation, nausea, vomiting, and constipation. Correct answer, B. Headache, hypotension, dizziness, and flushing. Rationale. Headache, hypotension, dizziness, and flushing are classic adverse effects of nitroglycerin, a vasodilator. Vasodilators, beta-adrenergic blockers, and calcium channel blockers are three major classes of drugs used to treat angina pectoris. NCLEX-RN Practice Questions. Question 4. A nurse is teaching a client how to administer Proventil to the client's child using a metered dose inhaler with a chamber. The nurse explains that the medication should be administered A. Just prior to the child's inhaling. B. As the child is inhaling. C. As the child is exhaling. D. Just after the child exhales. Correct answer, A. Just prior to the child's inhaling. Rationale. When using a chamber with a metered dose inhaler, the medication should be administered just prior to the child's inhaling. NCLEX-RN Practice Questions. Question 5. A nurse is working in an alcohol rehabilitation facility. A client she is caring for asks for a referral to a support group in the community that can help him maintain his sobriety. How should the nurse respond? A. Here are the phone numbers and meeting locations for Alcoholics Anonymous and Smart Recovery. B. I will help you enlist support from your loved ones. C. I will refer you to a primary care physician knowledgeable in caring for alcoholics. D. You will need to have your friends' support. Correct answer, A. Here are the phone numbers and meeting locations for Alcoholics Anonymous and Smart Recovery. Rationale. Alcoholics Anonymous and Smart Recovery are community organizations that provide group support to assist clients in abstaining from alcohol. NCLEX-RN Practice Questions. Question 6. A nurse is caring for a client who is scheduled for heart surgery the following week. The client wishes to appoint her spouse to make medical decisions for her in the event that something happens during the surgery. Which document should the nurse suggest to the client? A. Living will. B. Healthcare proxy. C. Do not resuscitate order. D. Power of attorney. Correct answer, B. Healthcare proxy. Rationale. A healthcare proxy appoints someone to make medical decisions in the event that someone is unable to do so. NCLEX-RN Practice Questions. Question 7. A nurse is observing a student perform care for a client with hearing aids in both ears. Which student action should be corrected by the nurse? A. Exaggerating mouth movements when speaking to the client. B. Standing directly in front of the client when speaking with the client. C. Keeping hands away from the face while speaking with the client. D. Making sure that the room light is on before administering care. Correct answer, A. Exaggerating mouth movements when speaking to the client. Rationale. The student nurse does not need to exaggerate mouth movements when speaking with a client who is hearing impaired. The student should speak clearly and slowly but naturally. NCLEX-RN practice questions. Question 8. A nurse is assessing a client admitted to the nursing unit with a diagnosis of dehydration. The nurse recognizes that early manifestations of dehydration include which of the following? A. Active seizures and coma. B. Increased thirst and dry skin. C. Sunken eyeballs and poor skin turgor. D. Tachycardia with accompanying hypotension. Correct answer, B. Increased thirst and dry skin. Rationale: dry lips and tongue, dry skin, mild headache, thirst, irritability, confusion, and dizziness are early signs of dehydration. NCLEX-RN practice questions. Question 9. A nurse is caring for an elderly client who lives alone. Upon assessment, the nurse notes that the client has poor hygiene. Which is the most appropriate referral for this client? A. Adult Protective Services. B. Primary care physician. C. Social worker. D. Psychologist. Correct answer, C. Social worker. Rationale: a social worker can help to find the most appropriate resources for this client, who may be having difficulty with performing personal hygiene activities at home. The social worker may need to arrange for home care services or help the client find an alternative living situation. NCLEX-RN practice questions. Question 10. A client is admitted to the orthopedic unit with a diagnosis of acute osteomyelitis. The osteomyelitis developed after an open fracture of the left femur. Which of the following nursing measures should the nurse anticipate completing in the treatment of this client? A. Administering large dosages of 4 intravenous antibiotics. B. Ambulating the client up and down the hallway twice daily. C. Maintaining the client's NPO, nothing by mouth, status. D. Providing the client with oral antibiotics 4 times daily. Correct answer, A. Administering large dosages of 4 intravenous antibiotics. Rationale: dry lips and tongue, dry skin, mild headache, thirst, irritability, confusion, and dizziness are early signs of dehydration. NCLEX-RN daily practice questions. Question 11. A nurse is documenting the weight of a 5-year-old child in kilograms for future dosage calculations. The child weighs 55 pounds. What is the child's weight in kilograms? _kg. Correct answer, 25 kilograms. Rationale: to convert pounds to kilograms, divide the weight in pounds by 2.2. So, 55 halves 0.2 equals 25 kilograms. NCLEX-RN daily practice questions. Question 12. A client has just returned to the nursing unit following a left below knee amputation as a result of arterial insufficiency. Which of the following actions should the nurse include in the postoperative care plan? A. Apply heat to the stump every 4 hours for 20 minutes. B. Elevate the stump for the first 24 hours postoperatively. C. Maintain the client on complete bed rest. D. Remove the stump's pressure dressing 12 hours postoperatively. Correct answer, B. Elevate the stump for the first 24 hours postoperatively. Rationale: the nurse should include elevating the stump in the client's plan of care. Stump elevation for the first 24 hours after surgery helps reduce edema and pain by increasing venous return and decreasing venous pooling at the distal portion of the extremity. NCLEX-RN daily practice questions. Question 13. A nurse is performing a fundal assessment on a client 2 days after delivery. Where in the abdomen would the nurse expect the fundal height to be located? A. 1 cm above umbilicus. B. At the level of umbilicus. Circa 2 cm below the umbilicus. D. Halfway between umbilicus and symphysis pubis. Correct answer, circa 2 cm below the umbilicus. Rationale: involution of the uterus, immediately after expulsion of the placenta. The top of the fundus in the midline and approximately halfway between the symphysis pubis and the umbilicus. About 6 to 12 hours after birth, the fundus is the level of the umbilicus. The height of the fundus then decrease about 1 finger breadth. The fundal height should be approximately 2 centimeters below the umbilicus on the second postpartum day. NCLEX-RN daily practice questions. Question 14. A nurse is caring for a client with free-floating anxiety. Which of the following symptoms would the nurse accept the client to exhibit? A. Chronic worry or fear. B. Fear about what will happen next. C. Repetitive behavior. D. Sense of impending doom. Correct answer, A. Chronic worry or fear. Rationale: a client with free-floating anxiety will have a fear or worry that is constantly present. NCLEX-RN Daily Practice Questions. Question 15. The nurse is caring for a client with a central venous access device. Which action should the nurse include in the client's care plan? A. Change the catheter every 3 days. B. Flush each lumen with heparin solution daily. C. Change the occlusive transparent dressing each day. D. Use aseptic techniques when caring for the device. Correct answer: B. Flush each lumen with heparin solution daily. Rationale: many policies do not include heparin flushes for central venous devices. According to the Infusion Nurses Society, INS, Standards of Care from 2016 Law KEDS, central venous access devices non-channeled, with either heparin 10 units per milliliter or preservative-free 0.9% sodium chloride, USP, according to the directions for use for the VOD and needless connector. NCLEX-RN Daily Practice Questions. Question 16. The nurse manager is made aware of conflict between two nurses. After speaking with the two nurses, the manager notes that there are no acceptable options to either person. Which stage of conflict is occurring? A. Avoidance. B. Approach. C. Avoidance. D. Resolution. Correct answer: A. Avoidance. Rationale: the stage of conflict that occurs when there isn't an acceptable option to either person is called an avoidance conflict. NCLEX-RN Daily Practice Questions. Question 17. A 6-year-old child is brought to the emergency room with an ear infection. As the assessment is being completed, the nurse notices that the child has bruises that encircle his legs just above the ankles and his arms just above the wrist. The child's caregiver has no explanation for the bruises. The nurse should: A. Confront the caregiver regarding the suspected abuse. B. Discuss stress reduction with the caregiver. C. Keep the caregiver away from the child. D. Notify the appropriate authorities of suspected child abuse. Correct answer: D. Notify the appropriate authorities of suspected child abuse. Rationale: the nurse is a mandatory reporter of suspected child abuse, therefore the nurse should report the suspected child abuse to the appropriate authorities. NCLEX-RN Daily Practice Questions. Question 18. A client seeks medical attention in the emergency department after developing acute abdominal pain 2 days prior. Which of the following actions by the nurse helps ensure accurate auscultation of the client's bowel sounds? A. Auscultating the abdomen by utilizing the bell of the stethoscope. B. Listening for 1 full minute in each quadrant to confirm absence of bowel sounds. C. Pressing the stethoscope gently but deeply into the abdomen. D. Requiring that the client empty his or her bladder prior to auscultating the abdomen. Correct answer: D. Requiring that the client empty his or her bladder prior to auscultating the abdomen. Rationale: the nurse should ensure that the client's bladder is emptied before auscultating because a full bladder may interfere with bowel sounds. NCLEX-RN Daily Practice Questions. Question 19. A child is admitted to the hospital with appendicitis. Based on this diagnosis, the nurse would expect to find which of the following while completing the admission assessment? A. Abdominal swelling. B. Decreased bowel sounds. C. Right lower quadrant abdominal pain. D. Right upper quadrant abdominal pain. Correct answer: C. Right lower quadrant abdominal pain. Rationale: right lower quadrant abdominal pain can be symptoms of appendicitis. NCLEX-RN Daily Practice Questions. Question 20. A nurse is assessing a 38-week pregnant client during a routine prenatal visit. The client states that she is tired because she has spent the last 2 days cleaning the house, preparing the nursery, and buying needed items for the baby. The nurse realizes these actions as which of the following? A. The latent stage of labor. B. Power of labor. C. Signs of false labor. D. Signs of impending labor. Correct answer: D. Signs of impending labor. Rationale: cleaning house, preparing the nursery, and buying needed items for the baby during the last weeks of pregnancy are signs that the client is nesting, which is a sign of impending delivery. NCLEX-RN Daily Practice Questions. Question 21. A nurse is assigning beds to 4 new clients being admitted to the cardiac telemetry floor. Which of the following clients would most approximately be assigned to the bed at the end of the hall, away from the nurse's station? A. A 27-year-old client with unstable hyperthyroidism who has a heart rate of 110 beats per minute. B. A 48-year-old client with mitral valve prolapse and sinus rhythm that is newly diagnosed with diabetes. C. A 55-year-old client in sinus rhythm transferring from the ICU 3 days post-coronary artery bypass grafting, CABG. D. A 75-year-old client with sinus tachycardia who is confused and agitated 3 days following a prostatectomy. Correct answer, A. A 27-year-old client with unstable hyperthyroidism who has a heart rate of 110 beats per minute. Rationale: the unstable client with hyperthyroidism will most likely be irritable and anxious and will require uninterrupted rest. The nurse should assign this client to a quiet room away from the noise of the nurse's station. NCLEX-RN Daily Practice Questions. Question 22. A nurse is caring for a child with tetralogy of Fallot. While attempting to administer the child's medication, the child begins to cry and becomes dyspneic and cyanotic. The nurse should place the child in which position? A. Left lateral. B. Knee chest. C. Sitting with head of bed elevated at a 90-degree angle. D. Standing. Correct answer, B. Knee chest. Rationale: to decrease the child's dyspnea and cyanosis, venous return needs to be reduced. Placing the child in the knee chest position or a squatting position will decrease venous return. NCLEX-RN Daily Practice Questions. Question 23. A client is receiving intravenous 4 heparin for treatment of deep vein thrombosis, DVT. Which of the following precautions should the nurse incorporate into the client's plan of care as a result of receiving 4 heparin? A. Check the client's activated partial thromboplastin time, UPT, values daily to monitor for therapeutic anticoagulation. B. Establish a separate intravenous infusion line for the administration of other prescribed medications. C. Have a vitamin K injection available at the client's bedside as an antidote to potential heparin overdose. D. Protect the heparin infusion from light by placing an opaque cover over it to prevent discoloration of the medication. Correct answer, B. Establish a separate intravenous infusion line for the administration of other prescribed medications. Rationale: 4 heparin should never be administered through the infusion lines of other medications, and other medications should not be piggybacked onto the heparin line. If other medications need to be administered intravenously, they require a separate infusion line. NCLEX-RN Daily Practice Questions. Question 24. A client being treated for cervical cancer receives a sealed radiation implant. When caring for this client, the nurse implements care based on which of the following facts? A. The client should be maintained on complete bed rest with bathroom privileges only. B. The client is considered to be radioactive for 10 days after implant removal. C. The client's urine, feces, and vomitus are considered to be highly radioactive. D. Soiled linens should remain in the client's room until after the client is discharged. Correct answer, A. The client should be maintained on complete bed rest with bathroom privileges only. Rationale: a client with a radiation implant should remain on complete bed rest with bathroom privileges only to reduce the risk of accidental dislodgement of the implant. NCLEX-RN Daily Practice Questions. Question 25. The parent of a preschooler contacts the physician's office to inquire about her child's flu-like symptoms. The nurse knows that to decrease the risk for Ray's syndrome, a child with flu-like symptoms or chickenpox should not be given. A. Aspirin. B. Antihistamines. C. Cough medicine. D. Tylenol. Correct answer, A. Aspirin. Rationale: due to the risk of Ray's syndrome, a child with flu-like symptoms or chickenpox should not be given aspirin. NCLEX-RN Daily Practice Questions. Question 26. A nurse is developing a plan of care for a non-pregnant client who is a gravida 2 para 1. Based on this information, the nurse develops the plan knowing that the client's pregnancy history includes A.1 pregnancy, 1 miscarriage. B.1 pregnancy with twins delivered. C. 2 pregnancies, 1 of which was delivered at or after the age of viability. D. 2 pregnancies, 1 of which was ended by elective abortion. Correct answer, C. 2 pregnancies, 1 of which was delivered at or after the age of viability. Rationale: gravida refers to the number of pregnancies, para refers to the number of births delivered at or after the age of viability. A gravida para 1 denotes a woman who has been pregnant 2 times and delivered 1 child at or after the age of viability. NCLEX-RN Daily Practice Questions. Question 27. A nurse is caring for a client with confusion secondary to a urinary tract infection. The client has just had a central intravenous 4 line placed by the physician for antibiotic administration. Following the procedure, it is important for the nurse to complete which of the following? A. Administer Ativan, lorazepam, as needed for agitation and anxiety. B. Discuss with the client the importance and purpose of the central line. C. Place soft restraints on the client's wrists to prevent dislodgement. D. Secure the line for policy and cover the line with gauze to disguise it. Correct answer, D. Secure the line for policy and cover the line with gauze to disguise it. Rationale: securing the line is required post-insertion of a central line. In this situation, disguising the fourth site with gauze will aid in distracting the confused client and keep the client from pulling out the fourth or catheter. NCLEX-RN Daily Practice Questions. Question 28. The nurse is caring for a client who was admitted for abdominal pain with unknown origin. The client reports severe pain and requests pain medication. The client has orders for both Tylenol and Percocet in the chart. Which action should the nurse perform first? A. Administer Tylenol as ordered. B. Administer Percocet as ordered. C. Assess the client's pain. D. Document the pain level in the chart. Correct answer, C. Assess client's pain. Rationale: the nurse should assess the client prior to administering any pain medication. This is to ensure that the client is not experiencing any complications or other serious event that requires immediate intervention. NCLEX-RN Daily Practice Questions. Question 29. A 3-year-old is brought to the physician's office because of a nearache. To perform the otoscopic exam, the nurse should gently pull the pinna. A. Down and outward. B. Down and back. C. Up and back. D. Up and outward. Correct answer, B. Down and back. Rationale: to perform the otoscopic exam, the nurse should gently pull the pinna down and back to fully open the ear canal. NCLEX-RN Daily Practice Questions. Question 30. The nurse is caring for a client who was recently diagnosed with terminal cancer. The client asks for a lethal dose of morphine because of a fear of suffering at the end of life. Which is the best response by the nurse? A. I'm not allowed to do that. B. Let me speak with the physician about getting an order. C. I can't administer the medication to you, but if you saved your pills, you might have enough. D. I can't do that, but we will make sure that you are comfortable during the dying process. Correct answer, D. I can't do that, but we will make sure that you are comfortable during the dying process. Rationale: it addresses the ethical and legal issues associated with provider-assisted suicide but also includes the client's fears about end-of-life care. NCLEX-RN Daily Practice Questions. Question 31. A nurse receives an order from the provider that states MS 4 mg 4 PRN severe pain. Which is the best action by the nurse? A. Administer morphine sulfate as ordered. B. Contact the provider for a corrected order. C. Speak with the nurse manager for clarification. D. Contact the pharmacy about drug abbreviations. Correct answer, B. Contact the provider for a corrected order. Rationale: the nurse should notify the provider for clarification and request a new order without the abbreviation. NCLEX-RN Daily Practice Questions. Question 32. A client presents to a community clinic with constipation lasting 5 days. Which intervention should the nurse recommend first? A. Go to the emergency department for disimpaction. B. Increase fluids to 1 liter per day. C. Use an over-the-counter enema or suppository. D. Decrease fiber to soften stool. Correct answer, C. Use an over-the-counter enema or suppository. Rationale: an over-the-counter enema or suppository can be used immediately to relieve constipation. If it is not successful, prescription laxatives or other medical treatments may become necessary. NCLEX-RN Daily Practice Questions. Question 33. A nurse is assessing a 13-month-old infant who has been vomiting for the past 3 days. The infant has become lethargic and has only had 1 wet diaper in the past 8 hours. The nurse expects that the infant's anterior fontanelle will be A. Bulging. B. Closed. C. Firm. D. Sunken. Correct answer, D. Sunken. Rationale: The nurse suspects that the child is dehydrated and therefore expects the anterior fontanelle to be sunken. NCLEX-RN Daily Practice Questions. Question 34. A nurse is reviewing dietary restrictions with a client diagnosed with Crohn's disease. Which of the following statements made by the client indicates that further teaching is required? A. Avoidance of carbonated and caffeinated beverages is highly encouraged. B. Eliminating spicy and fatty foods from my diet is now necessary. C. If I include milk and milk products in my diet, my Crohn's will flare up. D. I will include high-fiber foods in my diet such as fruits, vegetables, and whole grains. Correct answer, D. I will include high-fiber foods in my diet such as fruits, vegetables, and whole grains. Rationale. The client should understand that the recommended diet is low in residue and roughage and high in calories and protein. NCLEX-RN Daily Practice Questions. Question 35. A neonate that was born with trisomy 21 has a poor suck reflex and requires tube feedings. The mother expresses concern about forgetting how to perform the tube feedings when she gets home. As the nurse is planning for the infant's discharge, the nurse should consider A. Placing a home health nursing referral. B. Placing a lactation consultation referral. C. Scheduling a pediatrician appointment for the infant the day after discharge. D. Telling the client that she will remember how to perform the tube feedings. Correct answer, A. Placing a home health nursing referral. Rationale. A referral to home health nursing will ensure that the mother receives ongoing teaching and assistance with the tube feedings once the infant is discharged. NCLEX-RN Daily Practice Questions. Question 36. A nurse is conducting a home visit to a mother and 4-month-old infant. The nurse recognizes that the client needs additional instruction on providing the infant with a safe sleeping environment when she notices which of the following? A. A pacifier in the infant's mouth. B. No crib bumpers. C. A large stuffed teddy bear in the crib. D. The infant sleeping on its back. Correct answer, C. A large stuffed teddy bear in the crib. Rationale. Large stuffed animals increase the risk for suffocation and sudden infant death syndrome. NCLEX-RN Daily Practice Questions. Question 37. A client has developed digitalis toxicity. The client is stable. Which of the following actions would be considered most appropriate in this situation? A. Administering activated charcoal. B. Administering atropine. C. Preparing the client for hemodialysis. D. Symptomatic treatment and time. Correct answer, D. Symptomatic treatment and time. Rationale. Stable clients with digitalis toxicity are best treated with time while their kidneys excrete the metabolites. Symptomatic treatment for rhythm disturbances or nausea is also indicated. NCLEX-RN Daily Practice Questions. Question 38. A nurse is caring for a quadriplegic client who is at risk for developing pressure sores and ulcers. The nurse recognizes that which piece of equipment impedes circulation to the area it is intended to protect? A. Donut or ring-shaped cushions. B. Flotation gel pads and cushions. C. Pressure release wheelchairs. D. Specialty mattresses. Correct answer, A. Donut or ring-shaped cushions. Rationale. Donut-shaped or ring-shaped cushions are not recommended because they can interfere with the blood flow to the coccyx and cause complications. NCLEX-RN Daily Practice Questions. Question 39. A nurse is preparing a client for surgery and has administered a benzodiazepine to induce drowsiness and relieve anxiety before the procedure. Upon reviewing the chart, the nurse notes that the surgical consent form was not signed. Which is the best action by the nurse? A. Notify the surgeon. B. Have the client sign the consent form. C. Flag the form to be signed after the client wakes up from anesthesia. D. Contact the client's next of kin to sign the consent. Correct answer, A. Notify the surgeon. Rationale. The surgeon must be notified immediately and surgery may need to be delayed if the client is unable to sign an informed consent. NCLEX-RN Daily Practice Questions. Question 40. A nurse is assessing a 6-month-old infant. The nurse knows that according to Erik Erikson, if the infant's basic needs are not met by its caretakers, the infant is at risk for developing A. Doubt. B. Isolation. C. Mistrust. D. Trust. Correct answer, C. Mistrust. Rationale. When an infant's basic needs are not consistently met, the infant is at risk for developing mistrust. NCLEX-RN Practice Questions. Question 41. The nurse is caring for a pregnant woman who has been placed on bed rest for several months in order to prevent preterm delivery. Which instruction should be included in the teaching? A. Decrease fiber intake. B. Flex and extend the feet and ankles several times daily. C. Avoid changing positions while in bed. D. Reduce fluid intake to avoid nighttime urination. Correct answer, B. Flex and extend the feet and ankles several times daily. Rationale: venous stasis and muscle weakness are risks of prolonged immobility. Performing mild exercises, such as flexing and extending the feet, can help to minimize these risks. NCLEX-RN practice questions. Question 42. The nurse receives a phone call from a client's sister who asks about how a scheduled surgery went. What is the best response by the nurse? A. It went great. He should be back later today. B. The surgeon said there were no complications. C. I'll transfer you to the post-anesthesia care unit so you can speak with his nurse. D. We aren't able to provide any client information over the phone. Correct answer, D. We aren't able to provide any client information over the phone. Rationale: it is a violation of a client's right to confidentiality to provide protected health information to anyone who is not authorized to receive it. NCLEX-RN practice questions. Question 43. A nurse is caring for a female client newly diagnosed with anemia. The nurse will encourage the client to include which of the following iron-rich foods in her diet? A. Beef, chicken, and green peas. B. Luncheon meats and canned vegetables. C. Nuts, salmon, and potatoes. D. Strawberries, broccoli, and oranges. Correct answer, A. Beef, chicken, and green peas. Rationale: these foods are high in iron. NCLEX-RN practice questions. Question 44. A nurse has several tasks that are waiting to be completed. Which can be delegated to a nursing assistant? A. Assessing a client's pain level. B. Measuring fluid intake and output. C. Administering Tylenol to a client requesting a pain reliever. D. Performing a sterile dressing change. Correct answer, B. Measuring fluid intake and output. Rationale: measuring and recording fluid intake and output can be delegated to and performed by an unlicensed nursing assistant. The registered nurse must follow up on the results and make sure that they are within normal limits and don't require further intervention. NCLEX-RN practice questions. Question 45. A nurse has witnessed a client sign a surgical consent form. Once the provider steps out of the room, the client asks the nurse to explain everything that was just discussed and if there are any other options. Which should be the first action by the nurse? A. Notify the provider to come back and explain the procedure. B. Sign the witness section of the form. C. Document the interaction. D. Answer the client's questions. Correct answer, A. Notify the provider to come back and explain the procedure. Rationale: it is the responsibility of the provider to obtain informed consent. If the client does not understand the procedure, the provider must come back and explain the different options. NCLEX-RN practice questions. Question 46. Question number 46. A client diagnosed with emphysema is being treated on a general nursing unit. The nurse assigned to the client understands that which of the following nursing interventions are appropriate to include in the client's plan of care? Select all that apply. A. Administering low-flow oxygen. B. Encouraging alternating activity with rest periods. C. Keeping the client in a supine position as much as possible. D. Reducing fluid intake to less than 2,500 milliliters/day. E. Teaching diaphragmatic, pursed-lip breathing. F. Teaching use of postural drainage and chest physiotherapy. Correct answer, A, B, E and F. A. Administering low-flow oxygen. B. Encouraging alternating activity with rest periods. E. Teaching diaphragmatic, pursed-lip breathing. F. Teaching use of postural drainage and chest physiotherapy. Rationale: low-flow oxygen should be administered because a client with emphysema has chronic hypercapnia and a hypoxic respiratory drive. NCLEX-RN practice questions. Question 47. A nurse is teaching a client who is newly diagnosed with asthma how to correctly use a metered dose inhaler without a chamber. Client understanding will be evident if the client does which of the following? A. Avoids inverting or shaking the metered dose inhaler. B. Holds his or her breath for at least 10 seconds following inhalation. C. Inhales through the nose during activation of the device. D. Takes 2 rapid inhalations during one breath. Correct answer: B. Holds his or her breath for at least 10 seconds following inhalation. Rationale: correct instructions for a metered dose inhaler include 1. Remove the cap from the inhaler and shake well. Breathe out all the way. 2. Place the mouthpiece of the inhaler between the teeth and seal the lips tightly around it. Start to breathe in slowly, press down on the canister one time. 3. Keep breathing in slowly and deeply. 4. Hold the breath for 10 seconds to allow the medication to reach the airways of the lungs. 5. Repeat the previous steps for each puff ordered by the physician. Wait approximately 1 minute between puffs. NCLEX-RN Practice Questions. Question 48. A male client is admitted to the neurological ICU after sustaining a head injury from a hiking accident. The client is unconscious, and his pupils are non-reactive. The nurse caring for this client recognizes that which of the following interventions is contraindicated? A. Administering a barbiturate. B. Elevating the head of the bed. C. Performing a lumbar puncture. D. Placing the client on a mechanical ventilator. Correct answer: C. Performing a lumbar puncture. Rationale: the client's history and assessment suggest that he may have increased intracranial pressure. In this situation, a lumbar puncture should not be completed because it can quickly decompress the central nervous system and cause additional damage. NCLEX-RN Practice Questions. Question 49. A nurse has several clients waiting for care. Which client needs to be seen first? A. A client who is ready for a scheduled dose of pain medication. B. A client who is anxious about surgery tomorrow. C. A postoperative client with a blood pressure of 87/42. D. An elderly client who needs help ambulating to the bathroom. Correct answer: C. A postoperative client with a blood pressure of 87/42. Rationale: a postoperative client with decreasing blood pressure could be hemorrhaging or experiencing a life-threatening emergency and must be assessed first. NCLEX-RN Practice Questions. Question 50. A nurse is providing instructions on eye drop administration to a client. One eye drop is prescribed to be given in the left eye. The nurse recognizes further instructions are needed when the client completes which of the following during the return demonstration? A. Lies supine, pulls down the lower lid, and puts the drop in the lower lid. B. Lies supine, pulls up on the upper lid, and puts the drop in the upper lid. C. Lies with head to right, puts the drop in the inner canthus, and turns head to the left while blinking. D. Tilts the head back, pulls down on the lower lid, and puts the drop in the lower lid. Correct answer: B. Lies supine, pulls up on the upper lid, and puts the drop in the upper lid. Rationale: the client can either lie down or sit with the head tilted back. The eye drop is placed in the lower lid. An alternative method for clients who blink easily is to place the client in the supine position with the head turned to one side. The eye to be used is uppermost. With the eye closed, the client squeezes the eye drop onto the inner canthus of the eye. The client turns from this side to the other while blinking. Surface tension and gravity then cause the drop to move into the conjunctival sac.